This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're with us today. You know, we've been talking a lot about COVID-19, and most of the discussion has, for the most part, been around adults. Today, we want to drill down and talk a little about COVID-19 and children. We're delighted we've got Dr. Mary Suzanne Whitworth with us today. She's the Medical Director for Infectious Diseases at Cook Children's Hospital in Fort Worth. Dr. Whitworth, thank you for being on the show.
I'm happy to be here. Thank you for asking me.
As we look at the North Texas area, how has COVID-19 impacted children here in North Texas?
I think there are a number of ways it's impacted children. Fortunately, children seem to do better than adults with COVID. There are fewer sick children in general, and even the ones that catch this are not as ill as the adults are, and I think we're fortunate in that regard. I think children have probably had more negative effects from COVID from the way it's affected their lives. Their social activities have been curtailed or canceled. They are still in many places in limbo about whether or not they're going back to school, which creates anxiety, I think, for children. So they're dealing with a lot of uncertainty. Right now, I think that's been a big issue for children. They are also dealing with things like ill relatives, ill grandparents or parents, and that affects them also. So I think they have many effects of COVID besides just those children that become ill.
That's an excellent point. And I was going to ask you this. Are many children asymptomatic?
We do think that there are many children that are asymptomatic, and I wish that I could give you a number. I don't know what it is. There are estimates now that 20 to 40% of adult infections are asymptomatic, and children are probably in that ballpark, but I don't have an exact number.
So, in your opinion, if children are asymptomatic, in some cases, similar to adults, when school does start back, and I'm not talking about just virtually, but when we finally get to the day when children return to school, it's going to be important for the adults to wear masks and to be protected, don't you think?
Yes, the masks are going to be critical. Over time, there is more information that supports the safety of masking. The adults are going to need a mask to protect the people around them. The cloth mask protects the person who's wearing the mask more than it protects others. If everyone has on a mask, everyone has a tremendous added layer of protection. And so it will be important for the adults to wear a mask. And I hope, as much as it's humanly possible, that the children wear masks also.
When you look at what we've gone through at North Texas, how many COVID-19 cases have been treated at Cook Children's?
We're approaching 60 hospitalized patients since the start of the pandemic. It seems like, for the most part, the children come in for a day or two and they go home. We have had several in the intensive care unit, who have been critically ill, but probably approaching about 60.
As you look at parents thinking in terms of their children with flu season approaching us, some of the symptoms kind of overlap. Do you have advice for parents to tell if their child is having symptoms of the flu or COVID-19?
I think that is going to be a very difficult decision for anyone to make without a test, because really both of those diseases are fever and a cough, and so it could be either one when children have those symptoms. I don't think it's going to be very easy to tell. One of the things that may be helpful in the fall when both things are going around is if a child is ill and we know that the other 2 or 3 people in the house have the flu, probably the child has the flu. Or if the rest of the household has COVID, probably the child has COVID. So the exposure history may be helpful, but as far as symptoms go, I think it's going to be really difficult to tell the difference. I don't know how you could do it. The symptoms are very much the same.
You know, I know your specialty is infectious disease, so I'm going to ask you this question. Why is COVID-19 pandemic different than an influenza pandemic as far as going back to school?
Sure. We know historically that children really, really spread the flu. And children who have the flu readily pass that to those around them. And we know in the past that when there are flu outbreaks, if you close the schools, the flu outbreak is much better very quickly. So children spread the flu, and that has been a huge issue historically. So far in this pandemic, it appears that children become ill with COVID and have the virus in their nose and they can shed it, but it is much less likely to happen than it is with the flu. So children are less likely to spread COVID to other children. They are less likely to spread COVID to adults. Additionally, children seem to do better with COVID than they do with the flu.
So as you have seen the 60 patients roughly that you've treated at Cook Children's, how has COVID-19 impacted and changed Cook Children's?
I think that some of the things are probably universal impacts in the country right now. These are things like floor markers, how to stand 6 feet apart. We've got a lot of blue dots around here on the floor. Plexiglass shields to shield workers. We've made a couple of structural changes in that we now have a dedicated ICU for COVID patients that need intensive care. We have a dedicated floor unit for COVID patients that need routine floor care. And so those have been sort of set aside for COVID patients. I think one of the things that we have maybe benefited from the pandemic is this sense of being unified against a common enemy, for lack of a better way to put it. This is already this Cook has always been a great place to work, and there are plenty of awards and data to back that up. But I think that just over this last 4 or 5 months, there has been a tremendous sense of unification through this. I've probably put 50 more cell phone numbers in my phone because we all need to reach each other more easily and more readily. If I need to be able to get phone calls from the primary care world or from administration or from the command center, and we've all worked together so much on this. And like you and all of the hospitals that you work with, this affects every area of the hospital. The pharmacy, environmental services, occupational health, infection prevention. So I do think that we have been a unified system. I've been here for 25 years, and I think this has just caused even more laser focus around taking care of kids and keeping everybody safe in that regard.
You're listening to Dr. Mary Suzanne Whitworth from Cook Children's in Fort Worth. She, Steve, and I will all be back with more of this conversation right after this.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back to the human side of healthcare. You know, Thomas, a lot going on, and we got to remember people need to get their flu shots.
Boy, that's the big theme right now, isn't it? The signs are up and they are available. Now, Steve, why is it so important this year particularly?
Well, I've been talking to physicians, and this is what they're concerned about. You're going to have cooler weather, so you know you're going to have flu. You're going to have COVID-19. You're going to have upper respiratory issues, strep throat, and an integral part of some of those upper respiratory, as you well know, is West Nile. So there's just a variety of things out there. But there is the flu shot, and that helps prevent the flu. It is so important this year that we minimize influenza.
Would you tell us those statistics that you mentioned a couple of weeks ago about what was going on in South America?
Yeah, in South America, the Southern Hemisphere, it looked like in some places there was a 64% decrease in influenza one year to the next, and they attributed it to the efficacy of the flu shot and people practicing good physical distancing, wearing masks, washing their hands because of COVID-19. Wouldn't that be great if we had a 64% decrease here?
Oh my goodness, it would just make such a huge difference. It really, a potential news story would become a non-news story if we could do that, wouldn't it?
Absolutely. And the reason it's so important, Thomas, hopefully we won't have a second wave of COVID-19. But if we did, we're going to need that hospital capacity. So if people aren't there with the flu, that leaves capacity if we need it for COVID-19.
Well, we're going to continue our conversation with Mary Suzanne Whitworth. She's the medical director of infectious disease over at Cook's Children's in Fort Worth. And she's going to be talking about more of the impact on COVID with kids. And next week, we're going to be talking about back-to-school safety with also a pediatric expert from Cook Children's. So we're going to be covering this over the next couple of weeks because this is the important season when we're going back to school. It's on so many families' minds in North Texas, and the big deal is to do it safely.
Absolutely. We got to do it safely.
Parents right now, I know, are dealing with so much because classes are virtual and normally kids would be back in school as of this week in many districts around North Texas. And they're also dealing with the angst of when they do go back and how that's going to pan out. And we look at other states like Georgia where looks like there is a pop-up. So is that going to happen here? And all of that impacting our most precious parts of our family, our kids.
Yeah, and it impacts not only the family, but many of those parents have to work. And many of those parents need for their kids to go back to school, one, for the social aspects, two, obviously the education and learning, and three, it's practical because it helps them when they go to work. So parents currently have got a lot that they're having to deal with.
And as we educate ourselves, it helps us make better decisions. And that's why we're doing what we're doing here. Now, we're going to rejoin our conversation with Dr. Mary Suzanne Whitworth from Cook Children's in Fort Worth. And Steve, you have a very important question about a topic that is close to your heart, vaping.
Absolutely. Vaping is something that is very serious. And, you just got to think with COVID-19, what is the impact? I'm going to ask you a question that's kind of unfair and you may or may not want to answer, and I know we probably don't have evidence on it. But Thomas and I have side conversations sometime, and we were wondering, we very much support all the great activities of Cook Children's and the community to prevent our young people from vaping and using vaping products. And we've wondered, kids that vape and continue to vape, if they were infected with COVID-19, could that create even more complications?
It could. I do not know if we have had any of those kids here or not. We've certainly seen kids that vape throughout the past few years with horrible lung disease from vaping. And so I am not aware of any data that if you vape, COVID is worse for you. But we do know that if you have pre-existing lung disease, COVID is worse for you. And so I suppose that those who are vaping are going to get sicker if they get COVID. But to be fully honest, I do not have any proof of that, and I have not seen data about that.
Dr. Whitworth, Thomas Miller, I have a question. Anybody who grew up during the Depression never forgot it.
Right.
How do you think kids will respond to this through the rest of their lives?
I think that they will never forget it. I'm sure the rest of us will not ever forget this. I suppose they are going to remember this as the time that they closed the schools. I think they're going to remember this as the time that everybody wore a mask. I think they're going to remember this as a time of anxiety, that the people that they were around seemed to be a little more anxious than usual. And I don't think they're ever going to forget this time.
So it will have a lasting impression on people.
There is no question this will have a lasting impression on people. First, for a huge event, you would remember a war or a depression. Those are big events, and this is another one of those big events that I think we go through the whole process of shock and denial and grief and all of that our lives have had so much upheaval and a lot of turmoil. And for less fortunate families, ill relatives in the hospital and friends and relatives that have died.
Right, and those turn into, obviously, permanent scars. How lasting, and will medicine be able to treat these after COVID is just a distant memory?
I do think that there will be ongoing issues from this in the regards to anxiety and depression and all of the changes that these children and teenagers have had to go through. And I do think that they will need help. We are woefully inadequately staffed in this country for mental health workers, and the ones that we have are so busy that it's just hard for them to keep up. There's so much mental illness now. And I think as a society, we're going to have to pull together and work on the mental illness that these children are going to have, the depression really and the anxiety and the grief that they're going to have, we will have to deal with, I think, as a society. And when we want these children to be okay, I don't really think that's limited to children and teenagers. I think there are plenty of adults who will have those issues also.
One of the things I love about medical training is you are so keen at looking and observing, drawing conclusions, and then creating results. What are your observations of how kids are handling this, especially going back to school, knowing that COVID-19 is going to be a classmate this year?
I think it's a spectrum, Thomas. I think there are children who are young and happily oblivious, and they wear a mask to school because people told them to. And then I think probably those who have been affected, they've known someone with COVID who's been in the hospital or who has died, are going to have more anxiety about being out in public, And teenagers, I think, are more savvy to the media and to what's going on around them, and you worry that they're going to have anxiety. Teenagers are more able to transmit this to each other and to adults. Teenagers, as far as COVID goes, are more like adults as far as sharing the disease with each other and with adults and getting sick. And so you worry about how those kids are going to feel walking from staying at home all summer into a building that might have a couple of hundred people in it. That's daunting for many of us.
Absolutely. Dr. Whitworth, you've been a fantastic guest and you've answered our questions. But to our listeners out there, do you have any final words of advice that you'd want them to know about children and COVID-19?
I would say, like everything else, we want to protect the children from COVID. We want to protect them from any harm, and COVID is another potential harm, and we want to protect them. The best way to do that is to wear masks, and if the children can wear masks, we want them to wear them also. I think that is going to be key going forward, in addition to all of the other things that we have heard for these last few months. Frequent hand washing will help keep them safe. Try to encourage them not to touch their face or their mouth or their nose. Try to encourage them to stay 6 feet apart from each other. I think we want to keep our children safe. We don't want them to suffer from this.
Thomas, Dr. Whitworth gave us some great advice there about keeping our children safe. And speaking of safe, in this next segment, we're going to hear from Karen Yates, Kevin Cunningham, and Dr. Alan Taylor about how to be safe if you're having cardiac problems, emergencies, and don't be afraid to call 911.
Irreversible heart damage in minutes if you don't pick up that phone, and we'll dispel some myths about safety coming up next. Our episodes are on all the major podcast players. You can check the human side of healthcare, and we'll be right back.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the human side of healthcare. Today we're going to talk about a very important topic, calling 911, especially during COVID-19. We've got Karen Yates, who is the chest pain coordinator and the EMS liaison with Methodist Mansfield Medical Center here today. Also, Kevin Cunningham, who's the EMS chief with the Midlothian Fire Department, and Dr. Alan Taylor. He's an interventional cardiologist and the chest pain medical director with Methodist Mansfield Medical Center. You know, a lot of people have been fearful of calling 911, so I'm just going to ask this group, let's review with our listeners, what are some of the key symptoms of a heart attack?
Steve, I'll go ahead and take that question. So patients can present differently. Typically, most people think of the Hollywood version of what is a heart attack, which in many cases is true. So it's things like chest pain. It can be shortness of breath. Sometimes it can be arm pain, pain in the jaw, nausea or upset stomach. But then some patients, particularly female patients, diabetic patients, can have atypical presentations. Sometimes it's fatigue. Sometimes it's abdominal pain. So those are just to name a few.
You know, that's great information, and I hope our listeners won't be afraid to call 911. But along those same lines, when people come to hospital emergency rooms, approximately how many come by EMS or by a private automobile?
Great question, Steve. It depends on what they're coming to the emergency department for, but let's talk, since we're talking cardiac, let's talk about heart attacks. I'm going to particularly talk about one type of heart attack when it's blockage, major blockage in a coronary artery. Across the nation, about 70% of those patients arrive by private vehicle. We've done pretty extensive education in our region. So for my facility, we're actually down to about 40% of patients arriving by private vehicle, with 60% arriving by ambulance.
So in other words, for our listeners out there, if you're experiencing any of those symptoms, you should immediately call 911. Is that your advice?
That's correct.
So what are the real positives?
Absolutely. The most positive aspect of that is the fact that we can begin care for the patient, sometimes depending on the length of the transport to the hospital, 20 minutes before. It gives us a chance to notify the hospital that we are potentially bringing in a STEMI patient where they can have the cardiac cath lab ready and activated. And also from the pre-hospital standpoint, should the patient go into cardiac arrest on the way, then we're able to start treatment, start CPR at that very moment. So when they talk about time is muscle, we're helping with that in the cases of just being able to get everything going faster. And the other part of that is if you are having a heart attack, just the hazards that are involved of having a family member drive you or you even driving yourself and having a wreck, or if you're taking your loved one to the hospital, should they cardiac arrest inside the car, they're not going to be able to treat them.
In March, when we really started having lots of cases of COVID-19, and now we fast forward to where we are today in the midst of the summer. What have you experienced as far as, have people been afraid to call 911?
Most definitely. A lot of the systems across the United States, and especially MedStar out of Fort Worth, who has Matt Zavesky and them, have done extensive data mining on response times and patient outcomes. You're seeing anywhere from starting back in March into April, about a 30% decrease in run volume for EMS because of people were afraid to come to the hospital. And luckily that has improved. Most call volumes are back up across the nation, but you still see a lot of the critically ill patients out in the field who are afraid of coming to the hospital, your diabetics, some of your respiratory patients. that have underlying medical conditions, they're still afraid to call 911. So a lot of services are still seeing an increase in pre-hospital CPRs and also just patients that are deceased once we get on scene, because they are afraid of coming to the hospital that they might actually catch something there.
Dr. Taylor, I've talked to other cardiologists, and I was going to see if you had experienced anything similar. They told me, especially during March, April, and May, when people were very afraid to call 911 and they were having symptoms of cardiac problems, by the time they finally did come to the hospital, there was unfortunately some permanent muscle damage done. Have you experienced that any in the last few months?
Yes, we have experienced a delay of treatment for MIs, and unfortunately we have some data coming out in North Texas and nationwide. And this data is, number one, if you're having a heart attack, sudden cardiac death is a definite option, and that is when you drop dead, and at that point your life expectancy is measured in minutes. By delaying your treatment or by delaying coming to the emergency room, you run that risk. Sudden cardiac death is death within 1 hour of symptoms. So the sooner you get to the hospital, the better off you are. The second thing is time is muscle, and it's well documented in the cardiac literature that the quicker you can get that vessel open, the more viable or living myocardium you're going to have in the end, the better your heart function is going to be, and the better prognosis for a long and healthy life.
So let me ask you this. To our listeners out there who are still fearful of coming to the hospital because there are patients there being treated for COVID-19, can you help reassure them when they come to the emergency room some of the precautions you're taking to help protect them?
Coming through the emergency room with COVID-19, their temperatures are being taken. They're asked for symptoms of COVID-19. If there's any temperature or any symptoms that would be consistent with COVID-19, they're going into isolation, and then they're undergoing COVID testing to make sure. If in this it's a STEMI, then we do take care of the STEMI or the heart attack, because the heart attacks can be a very fatal event in a lot of cases. But even then, we do as much isolation as we possibly can, all the way in the emergency room, into the cath lab, and up into the intensive care units.
You know, as a physician, and I know sometimes people don't call 911, they take a family member and put them in the car and drive to the hospital. What bad things do you consider really happen to people when they drive family members to the hospital instead of calling 911?
This goes back to the sudden cardiac death, which is death within 1 hour of symptoms. That 1 hour is a key point. If you come to the hospital with chest pain, that's a very controlled situation. If you have sudden cardiac death, meaning your heart stops or goes into a fatal rhythm, you have 2 to 3 minutes to restore blood flow to the body. By delaying that, you're going to have a lot of problems. When you call 911, the paramedics are there within minutes. They have you hooked to the monitors. They're medically trained to take care of cardiac arrests, and they increase your chances of making it to the hospital. Unfortunately, I have also seen where the family member and or the patient themselves driving themselves get so tied up in the patient that they end up crashing their car and hurting themselves and or other people on the roads. So I do not recommend driving yourself or driving your loved one to the emergency room if you think there's a heart attack involved.
The other question I was going to ask you, and as a physician, you may not want people to do this, but I have a friend of mine, she happens to be a nurse, and she was at a friend's house, and her friend's husband started having chest pains. They immediately called 911, and she immediately gave him an aspirin. Would you recommend people doing that or not?
If they're thinking it's a heart attack, an aspirin, 325 milligrams, 1, 2, or 3 tablets is absolutely indicated, and it should be given as soon as possible. If the family doesn't give it, the paramedics will give it, and if the paramedics don't give it, then the emergency room will give it, and if the emergency room doesn't give it, then the cath lab will give it. So you will get aspirin multiple times, and very typically, even if the family member says we gave it, the paramedics and or the emergency room will give them some more.
So let me ask you this. What are the critical aspects of why people need to call 911?
Number one, I would be afraid of a heart attack because that's going to make you do what's right, and that's call 911. But not to be afraid to call 911 because they are your best option of having a good survival and good prognosis once you make it to the hospital. So yes, be afraid of a heart attack. Call 911 if you think you're having one, and that's going to give you your best chances of survival.
Are you seeing more stress-related cardiac events now?
Stress is really hard for me to define. I think more of what is stress is not the question. The question is, how do you handle the stress? And yes, when we go through stressful events, the number of cardiac events does go up across the board.
What are some of your do's and don't do's to maintain good heart health during more stressful times?
Number one, continue to eat a healthy diet, which is a low animal fat, high vegetarian type of diet. Number two, get at least 30 minutes of daily exercise, and that can be walking around the block, that can be a stationary bicycle, or that can be simple weightlifting with low weights in the upper extremities.
You're listening to Dr. Alan Taylor. He's part of a group of 3 people we have on the show right now, Karen Yates and Kevin Cunningham, joining him from Methodist Mansfield Medical Center to talk about cardiovascular health, cardiovascular safety, and calling 911. We'll continue this conversation right after this quick break on 1080 KRLD
and radio.com.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back. We're going to continue our discussion with Karen Yates, Kevin Cunningham, and Dr. Alan Taylor on why it's so important to call 911 and not to be afraid to call.
And speaking of the heart, Steve kicks off this segment with a question about a specific cardiovascular exercise.
Dr. Taylor, a friend of mine told me this, said that rowing is great cardiovascular exercise. Do you agree with that?
Rowing gets all 4 extremities going, so it is excellent exercise. The heart is a muscle. It's a smart muscle. It's a good-looking muscle, but it is a muscle. So any exercise that gets the muscle working, such as walking or rowing or stationary bicycle, any continuous exercise for 30 minutes is what the heart needs every day.
So, Karen, let me ask you this. What do you say to a listener who is experiencing a little chest discomfort and said, I've just got indigestion. I'm going to take a Tums or a Rolaids because I'm fearful if I go to the hospital and tell them I have chest pains and it turns out I really am not having a serious event, I'm just going to be embarrassed. What do you tell people so they won't do that?
You actually read my mind, Steve. That is a pretty common thing that we hear. And so people will tend to delay care because they've assumed that it's their GERD or it's stomach upset or something. What I tell people is if you've taken your whatever over-the-counter remedy that they normally use and they're not getting relief from that pretty quickly, that they should know what the normal relief is if they've ever experienced it before. If they're not getting symptom relief fairly quickly, then they need to think about the possibility of it is something else. It's amazing, even when they do come to the hospital, they sign in the emergency department with a complaint of their GERD is acting up. And many times we actually end up diagnosing them, clearing them of any GI disorder because, in fact, what they've had is cardiac issues that have been kind of waving a flag at them for a while, but they've been assuming it's something else. So, again, the real point is don't delay. If you're not responding to the treatment you normally would do, then go ahead and come on into the hospital, because you'd rather be safe than dead.
Absolutely. So let me ask you this. To our listeners out there that don't know CPR, where can they get a quick CPR training?
Honestly, even now in the current environment that we're in, because, clearly a lot of people are not doing the more traditional classes that you might have seen before. Now with the lay public, CPR is much easier to teach than what it used to be. You don't have to commit to a 4 or 5 hour long class. And essentially, I can teach the public CPR in 10 or 15 minutes. So in lieu of a class, I would say they certainly can go to websites. For example, the American Heart Association, I'm sure, has some good data online or good information online in regards to how to perform CPR. But for the public, they don't have to do mouth-to-mouth anymore. Now it's simply put your hands in the center of the patient's chest once you've determined that the patient is not responding to you and the patient won't wake up. So put 2 hands in the middle of the chest and pump hard and pump fast, and make sure that somebody calls the ambulance.
Karen, I was wondering, one of the angst I would imagine that families have when they're experiencing this in the moment is if they have that flash thought that they're not going to be able to accompany their loved one once they hand them off. How are you handling that?
You also read my mind on that question, because that definitely is a concern, and I know that has been a large part of what's delayed people in coming to the hospital, because they have that fear of being admitted to the hospital and not having family be permitted to be with them. And that is a challenge. It obviously makes the jobs more difficult for even us as caregivers, not to have the family always directly present at the bedside. Every situation is unique. There are some exceptions to hard and fast rules in hospitals. But I will tell you, from whether it's the paramedics in the back of the ambulance, the staff in the emergency department, the cardiologist, or other physicians in the hospital, everybody is doing an excellent job to be in as much a constant communication with families as possible, to keep them updated, to make sure that the families are getting phone calls, particularly if it's an incident where the patient is not capable of making those calls themselves. That way the family is not in the dark, and they really do know what's going on with their loved one in the hospital.
And then how does it complicate things if someone comes in and you determine rather quickly that they are not only having a cardiac event, but they also have COVID-19?
It does complicate things a little bit, because we do have to go through the screening process, because safety for not only our patients but also the staff is always at the forefront of everybody's concerns. But we take standard precautions on every patient. There's a lot of communicable diseases out there in addition to the new one that we're currently dealing with. But if the patient either is known to be positive or is checking kind of the checkbox that everybody goes down as far as suspicious symptoms, it just means that there's some additional personal protective, not only equipment, but steps that go into management of the patient to protect not only the patient, but also the staff throughout any procedure that they receive.
Hey, Kevin, I would like to ask you this. I know you're with the Midlothian Fire Department, but I've often wondered this. If someone calls 911 and says, my spouse is having chest pains, do firemen respond to that as well? Or is it, especially in smaller communities? Sometimes I've seen fire trucks pull up to people's houses. Is that what they're doing?
It is, absolutely. Most of your 911 services in the North Texas area are fire department based. You do have private ambulance services that will run 911 calls in cities. But on a call like chest pain, respiratory distress, stroke, you're always going to have a fire truck first respond with that ambulance. And the benefits of that is you're having the extra personnel on scene to be able to provide treatment in a more rapid fashion. And since the ambulances are usually what's the busiest in a service, the fire truck can get there ahead of time. And in most instances, they're able to perform a 12 lead and start pre-hospital treatment before the ambulance even gets there.
That brings up a very good point. And I know you have to do it within what's legal, but there are certain things that trained personnel and EMTs can do, and certain medications they can administer to help save someone's life.
Most definitely. You heard Dr. Taylor reference earlier about aspirin, and that's pretty much, ingrained by people's personal physicians, that if you're ever having chest pain, if you have a underlying cardiac history, they will tell them to take aspirin, and a lot of times they will have their own nitro. But you have a lot of your pre-hospital providers now that are going beyond the norm. In our instance, Midlothian Fire Department, we can start heparin in the field, and there are multiple other medications out there now that we can help stabilize the patient with, whether that's blood pressure medications, if you're bradycardic, we can provide medication to increase your heart rate. So we kind of refer to it as our toolbox of medications, but that's exactly what it is.
Do you communicate en route to the hospital in some cases with the emergency room physicians?
We do. So there's multiple things that we will do now, especially, with us talking about cardiac, strokes, things like that. All hospitals now, or I should say probably 95% of them, we have the ability to not only communicate with the hospital, communicate with the physician, but we're also able to transmit data from our LifePack or whatever monitor device that you're using. So if you are having a heart attack, exactly what we're looking at and we're seeing on our monitor, we're able to transmit to the hospital. And it's just an extra set of experienced eyes looking at the strip and helping us look at it and determine if, it really is a heart attack, so to speak.
Thomas, I hope people will not be afraid to call 911. And speaking of taking care of yourself, get your flu shot. And Thomas, go get yours.
Yes, sir. I promise. I'll do it right after I listen to the podcast, because all of these interviews are on our podcast channel. It's on all your major podcast players. Just search The Human Side of Healthcare. Next week, we're going to be talking about water safety and going back to school safely.
Stay safe, and all kidding aside, please get your flu shot.